Today's webinar, Culture, Development, Trauma, and Socio-Cultural Responsive Interventions with Youth Ages 7 and Older, is part of the webinar series, Trauma-Informed Care for Unaccompanied Children. This webinar was developed in partnership with Luis Flores, Executive Vice President of Serving Children and Families in Need, Dr. Susana Rivera, Program Director of Serving Children and Families in Need, and Dr. Javier Rosado, Director of Clinical Research at Florida State University Center for Child Stress and Health. For today's webinar, Susana and Javier will be presenting. Luis and Javier will be presenting on the Spanish language version of this webinar. After today's webinar, we hope that participants will be able to increase their knowledge of the developmental impact of child traumatic grief and separation, increase their knowledge of the impact of immigration-related separation on children's grief responses, understand common fears and perceived safety threats experienced by youth who have been exposed to traumatic events, recognize common needs that motivate acting out behaviors in children who have experienced trauma, and lastly, describe trauma-informed techniques for responding to acting out behaviors in youth with a history of exposure to stressful events. And now I would like to welcome Dr. Susana Rivera to present.
Thank you, Tracy. I would actually like to begin with a real story from a real family. Those of you who have been keeping up with the news have been hearing about the influx of immigrants who have been coming across the border in recent weeks. And one such family came across the border here in Laredo, Texas, where I live. For those of you not familiar with Texas geography, Laredo is in the southernmost part of the state of Texas, and we are right on the border with Mexico. So several weeks ago, we did meet with one family, Alessandro, who was age 14, and his sister Melissa, who was age 10, and their parents left Nicaragua because of violence in their city, and also their life as well as their family's life was in danger. Alessandro and Melissa asked their parents to please not be involved in the protests between civilians and the government. However, when their parents decided to join, they knew that things were going to change. So their parents, along with other people who were involved in the protests, were vigilant throughout the night. Next slide, please. Manuel, who is the father in this family, did not leave Nicaragua for financial reasons. In fact, he owned a welding business. He was quite successful. His wife was a soccer trainer in an American school. They left Nicaragua rather for safety reasons. Civilians in Nicaragua are protesting their government, and in turn, the government of Nicaragua has stated that any civilian who protests the government will be sentenced to 60-plus years in prison because they are considered terrorists according to the newly edited constitution. Manuel, the father, again, was part of the protests against the government, and he stated to us that the government and civilians who are armed by the government were looking for him and his family to kill them. He recounted that paramilitares attacked his city and 21 individuals were killed. It was at this point that he decided to flee Nicaragua to Costa Rica, where they remained for 4 months looking for asylum. However, they had multiple interviews, but nothing ever happened. The paramilitares were able to locate him and his family in Costa Rica, so they decided to flee yet again. Next slide, please. And on these slides, you can see their journey from Nicaragua up to the U.S. Manuel's uncle, who lives in California, sent them money as they made their way up to Guatemala. They remained in Guatemala for 15 days, staying with a childhood friend of Manuel's wife. Next slide, please. After this, Manuel and his family waited for 21 days to be able to obtain the proper documentation to travel through Mexico. They traveled by bus to Mexico, to the DF, to Monterrey, and then to Nuevo Laredo, Tamaulipas, which is our sister city here in Laredo. When his family, along with other individuals from Nicaragua and Honduras, arrived at the bus station in Nuevo Laredo, a group of men from one of the cartels surrounded them. He recalled feeling confused by the encounter because he had heard that Nuevo Laredo was not as violent as other border cities. After the cartel members realized the situation, they ordered a taxi driver outside of the bus station to take them to International Bridge 1, which is one of the ports of entry from Mexico into the U.S. here in Laredo. Mexican immigrant employees sent them to a refugee house with a pastor, while Manuel and his family waited for their turn to get processed by U.S. Homeland Security. They spent 48 days waiting in Nuevo Laredo, and there he was made aware that as other individuals from Cuba, Spain, Guatemala, or Honduras were arriving, they were able to get their appointment with the U.S. Homeland Security that same day. Next slide, please. When they were able to get their appointment with U.S. Immigration, then Manuel and his family were given a year permit to reside in the U.S. After this year, they do have a court date set in San Francisco, California, which is their ultimate destination. When we met with the family, they were in a temporary facility here in Laredo, just trying to make the connection with their family in California, trying to get in contact with them. The place that they were at is, again, a temporary facility where they are assisted with making phone calls. They are also assisted, if it's necessary, with obtaining money for bus tickets to get them further into the U.S. As far as we know, Manuel and his family did arrive safely in San Francisco. Next slide, please. And the purpose of sharing that story is just to illustrate that these are not just stories that we're hearing about in the news. These are actual families that people like me, people like my staff are coming in contact with. So these are very real things that are happening not only in the border but just across the country as these families are trying to make their way further into the U.S. We do know that most immigrant children and immigrant families, not just children, do have a prior trauma history, including trauma that is experienced in their country of origin. And this is really important to note because oftentimes when we are screening children, we are asking about their trauma histories, but we need to remember to keep in mind to ask very specifically about a trauma that was experienced in their country of origin, where they are coming from, because this is something that they may not feel it necessary to disclose. They may believe that they are only supposed to be disclosing traumas that they have experienced since they have been in the States. And we also want to pay attention to trauma that they may have experienced during the immigration process. You heard in the story of Manuel and Alessandro and Melissa and Manuel's wife, everything that they went through as they made their way from Nicaragua until they arrived here in Laredo, being surrounded by the cartel. Those were really, really scary experiences. So we want to consider any violence or political unrest in their home country. We know, of course, that there's a lot of political oppression happening in some of these countries. What happened during the immigration process? How did they get here? We see families who, again, I'm in Laredo, we're separated from Mexico by the Rio Grande. So some of our families get here by swimming across the river. They come here independently. In that case, they may have lost a loved one to drowning. That's really not uncommon. If they were smuggled here by a human smuggler, in my community we refer to them as coyotes, They may have been robbed. They may have been physically or sexually assaulted, or they may have witnessed the physical or sexual assault of a loved one. Once they do get into the States, are they being held until they can get more money, until the smugglers can get more money? Are they being held for human trafficking purposes? Um, and for those who do continue their trek further into the States, um, have they lost a traveling companion to the elements? We often hear, I live in a very, very hot area where during the summer temperatures can reach up to 110 or 115. And it's not uncommon for us to hear about immigrants who are making the trek and they carry food, but they don't often carry water or sufficient water. So they are exposed to the elements. It's easy for them to dehydrate. So it's easy to lose a traveling companion. We, of course, want to consider poverty and separation from their loved ones, and that's really the whole basis for this series of webinars is the separation. They, of course, leave their home country. They are leaving their community. They are leaving their culture. They are leaving family members behind. It's not uncommon for some of the family to immigrate to the U.S. first. For example, parents may come here first so that they can work, make some money, and then send it back to their country of origin in order to fund the trip for remaining family members. And during that separation, it's difficult to keep in contact with the family members who have already made it into the States. It's very difficult for them to sometimes access phones or be able to make those calls. So there's always that worry of, where is my loved one? Are they safe? Will I see them again? And even during the immigration process and once they get here, they may be separated. They may run from Border Patrol, and some are caught and deported, and some are able to hide. So there are a lot of things that we want to consider when working with immigrant families. Next slide, please. In regards to traumatic grief and separation, we know that parents and any caregiver really, these are the people who serve as protective factors for immigrant children. And the immigration process is a time when when the children are especially vulnerable. And that attachment between a parent and a child, this is really critical, we know, to a child's development, for them to develop a sense of self, a sense of safety, just feeling that the world is a safe place and being able to trust that there are people who are going to keep them safe. So that's really critical, again, to a child's development. But when you have prolonged separations between children and caregivers, or just any familial separation, that is going to have an adverse impact on these parent-child relationships, on these familial relationships. And oftentimes during the immigration process, these separations, even though they are a possibility, they're often sudden, and to a certain degree, they are unanticipated, and that makes them especially traumatic. Next slide, please. So when we're talking about defining traumatic grief, we want to think beyond death. Many children do experience the loss of a caregiver or other loved ones, and I think we do tend to think of, well, we grieve because somebody has died. But there are a lot of ways that children can experience a separation. It can be due to incarceration, and this is not only for immigrant families, but any time that a caregiver or any loved one that plays a significant role in the child's life, anytime they are incarcerated, then there may be a long-term separation. Of course, we're focusing right now on immigration and deportation. I can tell you that in my community, I see a lot of children who are what have long been referred to as anchor babies. And these are children who have been born in the States but have parents who are undocumented. So we are actually seeing a lot of these children right now who have had loved ones who have been deported and are either being held in detention facilities while they await deportation or have already been reported. In some cases, our children are able to just cross the border, visit with their loved ones, and then cross back. But that's not always the case. And even when they are able to do that, there's still that separation component. Of course, other ways that children can experience a separation are through military deployment, and there's that constant fear of safety, and the termination of parental rights for any children that are involved in the child welfare system. Next slide, please. So when does grief become traumatic grief? This is going to be when the response to separation between a parent and a caregiver is severe or is prolonged, and this is beginning to interfere with the child's functioning. Obviously, any child who experiences a loss is going to grieve. Any person really who experiences a separation is going to grieve for their loved one. But when it begins to interfere with functioning, then we refer to it as traumatic grief. And so children who develop these post-traumatic responses, so symptoms of post-traumatic stress because of a separation, may experience very similar clinical challenges as children experiencing traumatic grief. To reduce this impact, it's just really key to understand trauma-informed care. Next slide, please. So looking at the impact of traumatic separation, these are just some behaviors. This is certainly not a comprehensive list, but these are some things that we may notice in children. They may minimize or deny any previous traumatic experiences that led to the separation. I can tell you I was doing supervision with one of my staff earlier in the week, yesterday actually, and I'm listening to a recording where she's talking to one child, and when she begins to talk about trauma, the minute she mentioned the word, the child immediately said, "Oh no, I've never experienced any of that. No, we can go on. What's the next question?" So there may be that minimizing. There may be a lot of negative beliefs, a lot of cognitive distortions about the child, him or herself, but also about the absent caregiver. You may also see some disrupted development. So things that the child had already learned, they start to regress in a way. So we'll see the bedwetting, we'll see the thumb sucking, we'll see the baby talking. Distrust, we mentioned a couple of slides ago, that attachment between the child and the caregiver is really, really critical for that sense of safety and that sense of trust. So this is something that we're going to notice, that distrust of others, the distrust of the world, definitely the distrust of the system. And we need to realize, I as a therapist realize that I am viewed as part of the system. Obviously, there's going to be disrupted attachment, difficulty distinguishing safety from danger, and a lot of PTSD symptoms, the re-experiencing, the intrusive thoughts, the nightmares, the hypervigilance, always just being on guard for the other shoe to drop, almost. Avoidance of trauma reminders, and of course, I do a lot of CBT work, so I'm very attuned to affective dysregulation. So those that inability to regulate emotions, a lot of behavioral outbursts, a lot of anger, a lot of aggression, and again, a lot of those inaccurate, unhealthy thoughts, the guilt, the safe blame, the child thinking, what did I do? How did I cause this? And it's important when we're working with these children, in order to understand the behaviors, to always look at them through a trauma lens and to realize that even after the child is reunified with a caregiver or is in a safe and secure placement, these behaviors can persist. Next slide, please. So we want to look a little closer at the impact on children at different developmental stages. And again, this is not a comprehensive list, but this is some of what we may see in younger children. So maybe elementary school age, 7 to 10 years old. A lot of confusion about what is happening and why it's happening. This is one of the most common questions the children have is, why were they separated, and did they do something wrong? Did they somehow cause this? A lot of questions about reunification with parents, with siblings, with other family members. Am I going to see them again? When am I going to see them again? How come I can't see them right now? What is happening to them? Where are they? Where am I going to go next? We mentioned in the previous slide regression to younger behaviors, a lot of anxiety over separation. So you're going to start to see young children clinging to a person that they feel safe with. Not only worry also for themselves and what's going to happen to them, but a lot of worry about their loved ones. So a lot of thoughts of where are my parents? Where are my siblings? Are they okay? Have they been hurt? Who took them? What is happening to them? And of course, you're going to see differences in their reactions. Some children are going to become very withdrawn. They're going to isolate. With some children, you're going to see more of the overt behaviors, more of the anger, more of the behavioral issues. Next slide, please. And with older children, with adolescents, and even with pre-adolescents, now there's greater understanding of what is happening. Of course, they're thinking at a more mature level. They're starting to, you're going to start to see some distortions, a lot of jumping to conclusions, not always accurate conclusions, thinking things like, well, my parents are gone because they don't love me. My parents are gone because I was a bad kid, because I didn't follow the rules. I was the one who slowed them down, and this is why we were caught. So a lot of self-blame for maybe causing the separation or not preventing it. Also a lot of blame on the caregiver. If the caregiver had been more careful, if the caregiver had planned more carefully or better. Difficulty bonding with a new caregiver, even when children are in placement. It may be foster placement, it may be placement with another relative or a family friend, but just feeling guilty because if they bond with this new person, does that mean that they are somehow betraying their parents? And of course, a lot of the emotion, again, the sadness, the depression, sometimes just some numbing. You see these children and think, wow, they seem so cold. But this is just them numbing themselves and just detaching. And again, you may see some of that overt behavior, the anger, the aggression. But also as the children get a little older, you will start to see also some of the risk-taking behavior. So engaging in substance use and running away and maybe even self-injuring, self-harming behaviors. Next slide, please. So if these children do come to your facility, they do come to you for services, what if they're reluctant to engage in treatment? And this is really not very uncommon. Remember, they are distrustful of the system. So clarify your role. Let them know that you are a therapist, you're a caseworker, you're a case manager, you're an advocate, and stress that you are not immigration, you are not child protective services, you are not a government worker. And that's really important in order to start building that relationship with them. And answer questions as honestly and as simply as you can. And this includes being able to say, I don't know, when they ask a question that you're not able to answer. Normalize their fears, validate their fears or any other reaction, and this includes their isolation, their anger, their aggression. These are typical responses for somebody who has experienced a traumatic event. So we want to let them know that this is normal. There's nothing wrong with them. They're not crazy, which is going to be a big concern for a lot of them. Provide some education, provide some psychoeducation on what trauma is, on what treatment is about, because they may have very distorted views of what it means to be in therapy or what a counselor does. And let them know how they will benefit from this. If at all possible and it's developmentally appropriate, engage their siblings, engage any caregiver that they are with, and just simply be with them in the moment. Sometimes the best thing that I can do is just sit and be with the child and let them know that they are not alone. And it's also helped me sometimes to share anecdotal information and just talk about other children that I have worked with in similar situations, because this is going to be really important for them to realize that I'm not alone. I'm not the only one who's been through this. And I think it also instills a lot of hope. Next slide, please. And as we mentioned a few slides ago, we do want to look at the children through a trauma lens at all times in order to better understand their experiences and what they have been through. But we also want to keep a cultural lens in mind and realize that these are children, these are families that have been uprooted from their community. They've been taken from loved ones, they've been separated from loved ones. And just think about the loss and the confusion that comes with this experience, a lot of uncertainty of their future, missing their country despite the fact that there may have been oppression, despite the fact that there may have been violence, just missing home. And this is also confusing because I might miss my home, but at the same time, I'm a child, and I'm also glad to be away from there. So do I miss it or not? Am I happy to be gone? Am I sad to be gone? So these are things that children may think about. They're still processing the events regarding their journey, that before the journey began, during the journey, since they've been here, their interactions rather with immigration authorities, and their perception of the perception that these authorities have about them. We know that there is a lot of discrimination that is happening, and it's so difficult for children also to learn to adapt to a new culture. They may not speak the language. They may not understand our customs. They may not understand our rituals. They're unfamiliar with our service systems and the services that are available and how to access them. Just their awareness of their immigration status and just that fear that people won't believe them, that people will view them negatively as criminals, as invaders, and just remembering that they are extremely vulnerable and always keeping in mind this vulnerability. Because there is an imbalance of power between the people who are undocumented and have come here and the people that are living here legally or who have immigrated legally. Next slide, please. Also keeping in mind that traumatic experiences are going to be best communicated with someone who understands the nuances of the language. And, even for those of us who are fluent in Spanish, I speak Spanish, but even I have trouble communicating with families sometimes because our Spanish is different, and some words have different meanings in different countries. The dialects are different. So we want to be very careful about the words that we use, the connotation that is had, and just the choices that we're making when we communicate. And this can even refer to our inflection. And do we speak very loudly and very rapidly? Do we speak softly? Do we speak slowly? And just understanding the needs of the children when it comes to their culture and their language. And we want to foster that development of language skills amongst our staff and be aware of things like code switching. And we just also want to just enhance our knowledge of their culture, where they are coming from. Next slide, please. Again, remember that there may be variations regarding self-expression. This is our self-expression. This is their self-expression. We want to be attentive to loss reminders, and whenever possible, we want to try to, if as the resources allow, honor their culture. Is there a way to engage them in some rituals that they are familiar with, that they would typically have engaged in? This can be maybe listening to some music that is reminiscent of their culture. If we're translating materials, we always want to be aware of, how does this read? How does this come across? Am I being culturally sensitive? Am I using a word that is inappropriate? Maybe it's okay in my community, in my culture, in my Spanish, but not so much for them. And as we're trying to be culturally sensitive, we don't want to be individually insensitive. And we always also want to be aware of our own biases. Are we immigrants ourselves? If we are immigrants, did we immigrate legally? Were our parents undocumented? Were we born in the States? Can we trace our family back to the U.S. as long as we can think of? And how do we view immigrants coming into our country? Do we think they're trying to get a free ride? Do we think that they're lying? Do we think that they are trying to steal our benefits? Because I think raising awareness of our own thoughts, our own beliefs, our own biases is also really going to impact the kind of work that we are doing and the way that we are approaching families. I think I've said quite a bit, so I'm going to stop now, and I'm going to pass it on to my colleague, Javier.
Thank you, Susana. You perfectly laid down the groundwork for the second half of the webinar. What we want to do now is we want to give you some kind of practical tools that you can use in working with children who have gone through these different traumatic experiences. We know that the work can be challenging, and Susana did a great job at helping us understand what are some of the layers of complexity of trauma. What we want to do now is give you some ideas of how you could better respond to some acting out behaviors or difficult to manage behaviors that are common among children who have gone through these traumatic experiences. So what we want to start off with is an understanding of what does a child's behavior looks like when they have gone through these traumatic experiences. It's important for us to know that one of the lessons that children or youth who have experienced trauma learn is that the world is not safe, and that means that people may not be safe. Youth who have gone through these adverse experiences may feel like the adults in their life didn't protect them or maybe did not keep them safe or were unable to prevent bad events from happening. And so these experiences create a sense of danger in the youth. And so what happens is that you have young people who are walking around in what they perceive to be a danger zone consistently. So their response is that they're living in an environment that they perceive as dangerous or potentially dangerous, or they may see that the people around them are untrustworthy, and so they're often in survival mode. And the reason this happens is because of their prior experiences. Susana outlined the experience of a family at the beginning of this webinar. You can imagine if you're a young child who has had to flee from one country to the other and who has experienced adversity and danger, you don't recover from that easily. And so the effect of that is that on a daily basis, a child with that type of exposure could be living in what they perceive to be a dangerous environment. Now, the positive thing is that once a child starts to feel safe and secure, they will become more optimistic, they'll begin to feel hope, can start relaxing, maybe not be as hypervigilant. But before that happens, like we see on the screen here, as a child's feelings of safety decrease, acting out behaviors or difficult to manage behaviors increase. On this next slide, what you're going to see is that children with trauma often react to perceived threats that are both physical and emotional. And so there are things that could happen in a child's environment that could make them feel that there's a threat to either their physical safety or their emotional safety. So we'll start with physical safety. So at times, youth may react or even act out if they perceive that they could be physically attacked. So an example of that could be being bullied by a peer. If a youth is going to feel safe and be less hypervigilant, they really need to feel that they're going to be protected from being attacked. So if I am working with a young child or youth or an adolescent who has gone through difficult traumatic experiences, I need to be vigilant to make sure that that child does not feel that their physical safety is being threatened. So if I perceive that there are peers around them that are bullying the child, I need to intervene because I know that bullying could be a trigger that could cause that child to feel like their physical safety is at risk. Children and youth also need to feel that there's some form of protection in place so that they feel confident that they're not going to be exposed to dangerous risks or experiences. So, for example, if there's a youth who appears to be irritable or aggressive, the other children who are around that youth need to feel confident that they're not going to be the target of an attack because there's safeguards in place that are going to prevent such. So whenever a child is exposed to aggression, even if they're not directly the target of that aggression, so for instance, if a child is residing in a group environment and there are other children, maybe there are two other children who are fighting or being aggressive with one another, the third child who is simply being exposed to that aggression, they may react to that exposure because they feel like their physical safety is at risk. And in turn, their response to the exposure of that aggression could be acting out behaviors. We know that children can be hypervigilant after having experienced a traumatic event, and subsequent exposure to things like aggression could further exacerbate that hypervigilance. So we need to be really careful to look around the environment and address incidents of aggression because children may respond to that exposure. Another fear that can be common among children are fears of uncertainty. Oftentimes, this is related to basic needs, so like things like having a comfortable environment where they can rest safely. If they perceive that they're lacking that, a response to that could be acting out behaviors. So, for instance, children who are in congregate care, it's important that they feel confident that, for instance, when they're asleep, no one's going to take their belongings or no one's going to try to touch them or harm them. So we need to be really careful to create an environment where a child's going to feel safe and like their basic needs are going to be met. On the other side, we also have some examples of threats to emotional safety. So youth may react or act out if they perceive that they could be emotionally attacked. So it's not just the physical attack, but emotionally attacked as well. Examples of this could be when they are being yelled at or insulted or put down, whether that be by a peer or by an adult. And again, even if the youth is not the direct target of that put down or that verbal attack, if that's happening around them or in their environment, a young person will feel emotionally unsafe. And the response to that could be acting out behaviors. Lack of predictable routines can also be a threat to a child's emotional safety. Oftentimes, youth who have been exposed to trauma, they've learned that bad things can happen. So they're really kind of prone to expect the worst or assume that the worst is going to happen. So that means that when they do not know what's going on, that means when their environment is not predictable, what could happen is that they assume that something bad is about to happen. And so, again, they're going to feel emotionally unsafe. So it's really, really important to set routines, to have routine in place to make sure that a child's environment is as predictable as possible. A third threat to a child's emotional safety includes whenever there's a lack of consistency from adults. It's really important for youth to need that consistency from adults. Susana was mentioning in the first part of this webinar how important attachment is between a child and a caretaker. That is essential to a child's development, especially in the early years. A child has a need to attach to an adult. So in particular, when we're working with youth who have been separated from a parent or a caretaker, they still have that need to attach to someone. And so it's really important that there be consistency between the adults that are responsible for the child's care. This is especially true when children are living in group environments where maybe there are shift changes across a 24-hour period. When those shift changes occur, it's really important for there to be some sort of transition where the child understands that a different adult is going to be responsible or in charge for the next X number of hours. It's also important for there to be really consistent rules across shifts so that a child continues to feel safe and they don't think that things are going to change or their environment is going to be different because there's a new or a different person who is now going to be in charge or responsible for the next set of hours. So on this next slide, now what we want to do is we want to start talking about what do I actually do. So I know that there's a risk for children to act out. I understand that whenever there are perceived threats to either physical safety or emotional safety, that could increase the likelihood of a child acting out. But what are some practical things that I can do about it to help address those acting out behaviors if and when they do occur? So one really simple practical technique is to be really careful about not repeating commands. So by command, I mean when you're asking a child to do something. It could be something as simple as clean up your area or work on your homework or it's time to go to bedtime. It's really important that when we are giving that type of instruction to a child, we do a good job and try really hard not to repeat our instructions over and over again. Whenever there's an adult that's in charge and creates a sense of safety, that adult will give that command or make that request once. They will not be in a situation where they're going to get into an argument with a child or beg a child to do something. Simply what they do is they ask their request and then give a warning of a consequence should that request not be completed. But what we're trying to do is we're trying to be really careful about not making a situation where an adolescent or a youth is going to perceive that the adult has lost control. So we know that children are not going to comply or follow our instructions all of the time. That's very typical through a child's development. It could be frustrating for us as adults, but the really important thing for us to remember is that we can't lose control, right? And whenever we get into a situation where we're arguing with a child about following instructions, the consequence of that is that the children that are being exposed to that argument feel like you've lost control. And even the child you're interacting with individually, they feel like you've lost control. So the alternative to that is to use warnings and consequences. So we'll ask a youth or an adolescent, hey, John, I need you to do your homework, or I need you to make your bed. And we expect and wait for the child to respond and complete the task. If they don't do it, then our response should be to utilize a warning and a consequence to address their behavior. So, for instance, we might say, hey, John, I really need you to do your bed right now. If you don't do your bed right now, you're going to be late to recess, or you're going to miss out on 10 minutes of your free time. So you've given a warning and you've given a consequence, and you avoid getting into this argument with a child. It's very important to avoid arguments, because the argument in itself could be a trauma trigger. So for some children who have been exposed to violent environments or adverse experiences like domestic violence within the household, whenever they're exposed to arguments or people raising their voices, that could be a reminder of the trauma that they've experienced in the past. And so what we would want to do instead of arguing is to make a request, again, to state what you're asking the child to do, and maybe even consider giving an explanation. So help them to understand, or use that as a learning moment as to why you're asking them to do it. So for instance, if you're asking them to clean their area, you may want to say, hey, John, I really need to clean your area. If you have things laying on the floor, somebody else could trip and fall and hurt themselves. So you want to use these techniques to try and help that child to follow through with what they're expected to do, instead of ending up in a situation where you're arguing with the child. Another thing that we want to really avoid is yelling or raising our voices, speaking harshly to children. Whenever people yell, it's because they're feeling helpless and frustrated, and we've all been there. We especially for those of us that are parents and are trying to get our children to get ready in the morning, and we're in a rush and we really need them to clean their room. When children don't follow instructions, we get frustrated, and oftentimes we end up yelling our voice or using harsher tones of voice or even harsher vocabulary to try and get compliance from a child. But we have to be really careful to avoid that, especially when we're working with children who have previous traumatic experiences. Those types of behaviors could be perceived by a child as a danger signal that something worse is coming. So their expectation is that after you raise your voice, maybe you're going to become physically aggressive, maybe you're going to hit them, and so they're going to go into self-defense mode potentially, which could be interpreted as resistance or an acting out behavior. So we have to be really careful to instead state our feelings and our expectations in a calm manner. So remain calm and in control at all times. We also want to be really careful about avoiding threats. Whenever we're using threats, that probably means that we're losing control. So the adult's losing control, and they feel like they need to rely on something more to change the youth's behavior. So instead, what we have to do is we have to establish rules to manage behavior, especially if we see that there are common problem behaviors. We have to set rules, which we'll talk about in a moment, to help set the expectation. We also want to be really careful about avoiding things like hitting, throwing, breaking. I know it's kind of common sense that when we're working with children, we wouldn't do those things. However, we're all humans, and we can all lose control if we're not careful. We each have our own triggers as well, and sometimes in working with children, children's behaviors push some of our own buttons, and so it's really, really important that we, again, stay in control. We don't lose our control. We manage our own emotions well. The risk here of engaging in these types of aggressive behaviors is that we could create a new trauma for the child. Even if it's less severe than what they've gone through in the past, it could still create a new traumatic experience for them, and it could reinforce this perception that they already have that the world is unsafe and that people are unsafe. So on this next slide, what we want to talk about are some things to try and to do. One really simple technique that you can do that's really effective is to use the word safe. This should be one of the most frequently used words when we're working with children. Every intervention that we select to try and address misbehavior or acting out behavior should be explained in terms of safety. So, for example, if you're working with a child and you're trying to protect or correct their pushing behavior, so they're pushing or hitting another child, you want to correct that misbehavior. So when you approach that child, you don't tell them to stop hitting or pushing because it's not nice or because it can hurt the other child's feelings, but instead you correct them and you say, we don't push or we don't hit because he doesn't feel safe when you push him. He feels attacked. So we want to literally use the word safe to try and begin changing a child's perception that the world can be a safe place and that we're trying to make it a point to create a safe environment for them. We also want to be careful to use rules effectively. We mentioned that it's important to set expectations, to use rules, consequences, warnings. When we do use rules, we want to make sure that we use few rules and simple rules. And we want to make sure that we can repeat these rules so that they're easily learned, and we want to frame the rules in a positive manner. So on the screen, you see a few examples of rules that are framed in this way, in a positive manner. So an example would be follow directions. That's kind of a catch-all. So if you ask a child or you instruct a group, we're going to follow directions. You're setting the expectation that whenever the person in charge gives a direction, the expectation and the rule is that you're going to follow that direction. Another example is let teachers teach, let students learn. So this addresses potentially disruptive behavior. So you've again set the expectation that the teacher's teaching, the students are learning, and any behavior that interrupts either the teaching or the learning is inappropriate. So again, the point is we want the rules to be very few, to be very simple. We want them to be repeated oftentimes so children can overlearn them, and we want them to be stated in a positive manner. Another tip for you as you're working with youth is to always be vigilant. This means intervening anytime there's a potentially unsafe situation way before it gets out of hand. So for instance, if you're in a group environment and you see two children who are maybe play fighting or are jokingly teasing each other and they're doing it in a playful manner, it's important to be really vigilant of behaviors like that because there's a risk there that will escalate to a fight or to hurt feelings or to other acting out behaviors. So it's really important to try and be really vigilant and prevent and intervene early on when you see behaviors that could potentially be problematic. At first, it may seem that if you're being too vigilant, you're being too strict, but it's important to remember that this is very necessary to help youth feel calm, to help them feel safe, and to feel secure. So if you have this feeling that you're being a little bit too strict and you should be more lenient in addressing behaviors like that, keep in mind that the goal here is to create a safe environment for the child and to help child feel safe, well supervised, even when a child maybe expresses dislike at the way that you're setting rules or when you're interrupting their behaviors, trying to prevent problematic situations. The goal is to create a safe environment. We mentioned before that routines are extremely important, so that helps a child to also feel safe, to follow the same schedule, especially across shifts. Whenever there's a necessary change to the schedule or to the routine, letting the children know as far in advance as you can, that could help maintain that sense of safety. Oftentimes when there's a sudden change or something unexpected happening, a child could feel threatened or unsafe. So it's important to let them know of any anticipated changes as soon as possible. Another quick tip that oftentimes is helpful is to have safe spaces within your area with defined functions, like having a cooling off space. Susana mentioned earlier that emotional regulation can sometimes be difficult for children who have experienced traumatic experiences, so it's hard to regulate or to control their emotions. So having a cool off space where a child knows this is a designated area where I can go to cool off. It has nothing to do with being in trouble. It's not a timeout. It's just a safe place where I can go and calm down and gather my thoughts and my emotions. A lot of times that can also help a child by giving them that sense of safety and a space where they can kind of gather themselves and figure out how they're going to respond to that stressful situation. Next slide, please. So we're on this quest, right, to figure out what do I do? How do I respond to these acting out behaviors? There's two steps that we're going to walk through in the next couple of minutes. The first step is really aim to understand. So whenever I'm trying to address the misbehavior or acting out behaviors, I first have to understand where the misbehavior is coming from before I respond. That's really half the battle right there, is understanding misbehavior. Every child's behavior has a reason behind it. There's a reason why a child acts the way that they're acting. I first have to aim to understand the behavior so that, second, I can use the proper techniques and respond appropriately. So let's dive into step number one, aiming to understand. In this next slide, you're going to see that youth act out because they're motivated by basic needs. So oftentimes there's a need behind an acting out behavior. So for example, desire for feelings of mastery. This means that children need to feel that they're good at something. They need to feel confident. They need to feel that they're able to master a task that has to do a lot with their self-esteem. So sometimes a child may be acting out because they're trying to get that feeling of mastery, or they don't have that feeling of mastery, and so their response is to act out. Another example would be desire for feelings of belonging. This goes back to the attachment piece that we keep talking about. Children need to feel like they belong. They need to feel an attachment, whether that be to a caretaker or to peers. Children have desires to feel like they're in control. This is particularly true for children who have maybe experienced chaos or unpredictable, unsafe environments. They may be acting out in an effort to gain some of that self-control. Need for attention is also another important common desire. Children need to feel like they're receiving attention, and oftentimes they aim to get that attention, whether that be in a positive way or in a negative way. So whenever we see that a child or a youth is acting out, we first need to figure out what is the motive behind it. Are they acting out in order to meet one of these basic needs? And if that's the case, how can I better address that? So let me give you an example to see if we could better make sense of this. If I'm working in a school setting, or I'm a caretaker and I'm working with a teenager who I'm told cuts school on days when she has to go to the gym. So usually what will happen is before she goes to gym class, she starts to feel anxious, and then her reaction to that is to escape the anxious feelings by leaving the school. So she skips that class. So based on what we're talking about, what we need to do is help that adolescent kind of figure out where the acting out behavior is coming from. So you're skipping gym class because you feel anxious, because you feel unsafe. How can I better help you? So that adolescent wasn't trying to be bad. They were just trying to get away from their feelings of anxiety, and their way to do that was by skipping that gym class. So we need to be careful to figure out why are they acting out, and is there anything that we can do to address the need or the feeling behind it. On the next slide, you're going to see a brief example. Oftentimes when youth act out, especially youth who have experienced trauma, there are these antecedents to acting out behaviors. Next slide, please. We're going to look at an example of a specific adolescent in this next slide who really gives us a good example of why acting out behaviors occur. So when youth become, the example of youth that we're going to talk about is a youth becomes aggressive when a house parent uses a loud voice to correct her behavior. Why would this adolescent become aggressive when the house parent raises his or her voice? Well, her stepfather in the past would yell at her while physically abusing her. So what's happening is harsh or loud voices become these trauma reminders that cause this adolescent to act out. So for children, specifically children with complex traumas, there can be things in the environment that are really triggers for them of their prior trauma, and then acting out behaviors occur because of that. Next slide, please. So here's the story of our youth. This is the picture of the youth that we just talked about, and then we'll go on to the next slide now. So how do I respond to these acting out behaviors? We're talking about all of these different tips. One really super effective tip, but kind of hard to do, is what we call selective attention. So selective attention is when an adult makes a decision not to react to certain behaviors. So in essence, to ignore certain behaviors. So we talked about that a child needs attention, right? And a child will do things even that are negative at times to get the attention of an adult. So we have to be really careful how we respond to acting out behaviors, because we could unintentionally be reinforcing the negative behavior. When a child acts out, an adult could respond by giving that child more attention, which in turn could make them act out more to get more attention. So we need to be really careful about sometimes ignoring acting out or misbehaviors so that we're not reinforcing them. So some examples of behaviors that you would be better off just ignoring would be things like temper tantrums or talking back at the adult, making nasty faces, rolling of the eyes, maybe smirking back at the caretaker, making fun, mimicking the adult, or maybe even comments that are meant to be intentionally annoying to the adult. These are some things that we would be better off ignoring. So don't feel bad sometimes when you're ignoring some acting out behaviors. I know as an adult we feel like we need to address misbehavior, but sometimes selective attention or ignoring of misbehavior is the most effective way of addressing the behavior. Don't feel like by ignoring it you're saying that it's okay. Next slide, please. So we're talking about these techniques, right, to help address misbehavior, to manage acting out behaviors. One thing that we need to be really mindful of is helping the adolescent manage difficult affective states. So this is simply helping the adolescent manage their own emotions. So youth typically will learn to regulate or control their emotions based on the quality of their interpersonal relationships. So this means that they learn how to manage their emotion based on how they grew up, based on their environment. But if a youth grew up in an unstable environment or a stressful environment, a neglectful environment, the consequences could be that they are going to have a hard time self-managing both their emotions and their behavior. So we need to help an adolescent manage their emotions and help them understand how they may react to some stressful events. So, for example, if we look at the case of Jane, if she's sitting at a table doing her homework and suddenly another youth runs by the table, hits Jane's arm, and causes her to almost mess up her work, Jane could have several thoughts in response to this incident. She might think this other student hit me by accident, or she might think he bumped my arm on purpose, or she might think he hit me on purpose and he could make me mess up my work the next time. Jane's response is really going to depend in large part on a lifetime of experiences that she has had. So if she has had a lot of adverse traumatic experiences, she might be more prone to think about that this happened on purpose, that this person intended to make me mess up. Remember, one consequence of being exposed to trauma is that you feel that people are unsafe and the world is unsafe. And so Jane's reaction could likely be acting out or retaliating towards the student. So as the caretaker that's in charge, as the adult that's in charge, when I'm responding to Jane's outburst in this situation, I need to be mindful that she's responding the way that she's responding, possibly because she has learned from her previous experiences that she needs to be in survival mode. She has learned from previous experiences that the world is unsafe, that people are out to get her, and she's responding accordingly. And so I need to address her acting out or misbehavior accordingly. On the next slide, you're going to see just some simple strategies to help children manage their emotions. So we want to help children learn to recognize when they're starting to feel distress. So don't wait until they blow up. Look for warning signs. Help them by teaching them to take deep breaths, again, using a calming space, maybe suggesting writing in a journal, or even suggest that they help someone else. Remember, children need to have this feeling of mastery, that they're good at something. So sometimes suggesting that they help a peer might even be a way to increase their self-confidence, and in turn, that's going to reduce acting out behaviors. Whenever a child can talk with a counselor, that is oftentimes helpful. With a counselor, they can learn things like problem-solving skills. So if you're a counselor yourself and you're working with an adolescent, it's important to teach problem-solving skills and other social skills that are going to help them manage their own behavior. On this last slide, this last point that I want to make is one way to foster healthy interaction with children and oftentimes to focus more on positive behaviors versus acting out behaviors is to use praise. So you'll see an acronym here for praise. Really what this has to do with is increasing the amount of time that you spend actively praising the child for specific positive behaviors. So a quick tip for this is you want to provide purely positive praise. So this means that you don't want to do things like adding negative tags to your praise. This would be doing something like if you've been working with Johnny to take out the trash and he never wants to take out the trash, and you ask, hey, I want you to take out the trash and I want you to replace the bag after you're done. He finally does it one day. You praise him by saying, hey, thanks a lot. I really appreciate you taking out the trash. Thank you. That's a wonderful praise. A negative tag would be if at the end of that praise you say something like, if you could only do that every day. So we want to avoid that because that kind of messes up the praise. We want to keep it purely positive. We want to repeat the praise consistently. We want to acknowledge small steps. So even if they're not fully doing what we ask them to do, but they're doing part of it, we want to acknowledge that they did part of it. We also want to praise intermittently, meaning that once they've started to do the good behavior, we don't just want to stop praising altogether. Occasionally, we want to keep letting them know they're doing a good job. We always want to be specific about what they're doing correct, and then we also want to be really enthusiastic and genuine that we appreciate what they're doing well. So praise is really important as well. So I know we're running out of time on our webinar, so I'll kind of pause there and see if we have any questions.
Yeah, thank you, Susie and Javier. I think that was really excellent. I do believe we have some questions. Susie, do you have one that you can sort of ask Javier to respond to?
Yes, one of the questions that had come up was, how do you address acting out behaviors of immigrant children who are in congregate care? Would your approach be similar to children in a home versus in a group setting?
Yeah, that's a great question. So I think there are some differences between acting out behaviors in a home setting versus a group setting. In particular, because in a group setting, there may be a greater number of perceived threats, and so therefore a higher likelihood that the child's going to act out. So remember, we talked about perceived threats could be both physical and emotional. So physical would be bullying from peers, exposure to aggression, or even lack of basic needs, which could include sharing the resources that are available in a group home. So I think whenever you're in a group setting, there may be more perceived threats. So that means that the risk for acting out behaviors may be a little bit higher. Now, how you address that acting out behavior, I think the approach is similar between home and group settings. But adults, I do think, need to be much more vigilant in a group setting, again, because the number of perceived and sometimes actual threats in a group setting could be greater. But still, across settings, it's important to create a safe environment, do things like keep routines, make really clear commands. That means give instructions, clear instructions with warnings, consequences, create a safe place. One suggestion was to have a calming down area or corner that could be done both in a group setting and in a home setting. And then kids across settings are going to benefit from learning things like relaxation techniques, deep breathing, muscle relaxation. These are all things that children are going to benefit from to better manage their emotions and behaviors.
Thanks.
Thank you.
Javier. Thanks, Javier. I think we did send a question for you that really I think Susie can help answer.
Yeah, so there's another question that was submitted, and that is that there seem to be more immigrant children under the age of 10 who are exhibiting aggression or anger or out of control. So how sometimes these are difficult to manage behaviors, right? So how do we handle children in a group setting that are more prone to be referred for mental health evaluations, prescribed medications, at times hospitalized to manage these behaviors? Do we have any recommendations as to how to best handle these children's behaviors?
That is a really good question, because I think that a lot of children, because they are acting out, parents are not sure how to respond to those behaviors. And so these children typically do get referred for a psychological evaluation, for medication. And a lot of these behaviors escalate to a point where children are being hospitalized. But I think that to an extent we can prevent some of this. In terms of working with children, I think it's a great idea, first of all, to, we mentioned this earlier, to normalize and validate for them that it's okay to be angry. It's okay to be upset. It's okay to hate the situation that you're in. Make it okay for them to experience this, but then talk to them about it's also okay to let out that anger and frustration, but let's talk about how we're letting it out. Let's talk about how we are showing our emotion, because there are healthier, there are safer ways of expressing ourselves in a way that is not going to hurt us, in a way that is not going to hurt somebody else. And this is something that obviously we're going to do through therapy, but I think it's also very important to work closely with caregivers, whether it be the caregiver in the home or whether it be the staff in a group setting or some other type of facility, to help them to understand where is the behavior coming from. And to help them understand that these behaviors, it's not necessarily an attempt to lash out. They're not trying to be oppositional. These are children who are trying to process something that is very overwhelming. These are children who do not feel safe, and this is their attempt at trying to establish some bit of control. So I think a lot of it is, like I said, just validating and normalizing for children and helping them to find healthier ways to express themselves, but also working very, very closely with adults and teaching them a lot of the techniques that Javier spoke about on how to manage children's behaviors so that they do not escalate.
Thank you to both of you. So this actually concludes today's webinar. And I want to thank both Susie and Javier, and then also as well Luis, for helping to sort of develop this content. And I'd also like to thank all of you for joining us and watching this webinar. And I do want to remind everyone that you can log on to the NCTSN Learning Center to complete the evaluation. And if you're interested in CE credits, you need to complete the post-test, and then you'll get a certificate. And so I want to thank everyone for joining us today. Thanks.